So I will be speaking about gut health. I'm really excited to present this to all of you. I think it was interesting to think about some of the comments that some of the previous speakers made. Dr. Kopecki this morning was talking about diet, I believe being the number one cause of the majority of deaths in the world, or related to that. And later spoke about, certainly as others have, the benefits of the Mediterranean diet. We've heard things like anti-inflammatory, and I don't think we've talked as much about what the potential mechanisms may be through which diet leads to good health, but let's say potentially poor diets leading to bad health, and what is the mechanism. And the key there is obviously through the gut. And so I'm hoping by the end of this relatively brief talk, this is more will be an intro for those of you that are not all that familiar with the role of the gut and how it works and how it relates to our health and the development of disease. Hopefully this will spark a real interest as a sort of jumping off point. I have some neat slides I hope you'll enjoy, and the Institute of Functional Medicine was kind enough to allow me to use some of those slides. I'm just giving them credit. I have nothing relevant to disclose. And what I'm hoping to cover with all of you today is we'll talk about some of the key functional roles of the GI tract. We'll talk about impairments and how that can lead to dysfunction and other things that can influence dysfunction of the gut. And then how the GI tract itself then through dysfunction primarily can lead to the development of chronic diseases, certainly influence many of the symptoms that our patients may present complaining of. And let me start by saying that the gut is complex. And again, as I've just alluded to, this is a relatively brief presentation to try to cover a very complicated subject. And so I wanted to really introduce the subject to you and primarily give you a better sense of what I think certainly some physicians and healthcare providers out there still don't quite recognize as even existing, this concept of leaky gut or increased intestinal permeability. And if I had been a little bit brighter with this presentation, maybe I would have put a poll question now that said, how many of you believe that this is a real entity? And then maybe polled you at the end to see if I was able to convince you that this is something that you should be familiar with and that certainly does exist. But we'll see how it goes. So why focus on the gut in general? Well, there's a number of reasons. I just gave a few examples. Giving a few examples. It makes more serotonin in the brain. It's the largest immune organ in the body, and we'll talk more about that. There's at least as many, maybe I should have said this the other way, bacterial cells in the microbiota as there are human cells. There is quite a bit more genome in what's referred to as a microbiome, which refers to the genetic material within the microbiota, which are the bacteria itself and protozoa and others, much larger than the human genome. And the metabolic functions are really comparable to the magnitude of the liver, and we'll talk more about that. So this is a pretty strong statement. The most effective clinical outcomes across all disease spectrums can result from normalization of gut function. Strong statement. Maybe I will have at least begun to convince you of some of that by the end of this presentation.